Today is Monday, April 13th, 2020. Coming up next on Roland Martin Unfiltered, the latest when it comes to COVID-19. We'll be joined by Congresswoman Yvette Clarke to discuss how the immigrant community in her district is being impacted, how the Trump administration are sending back folks to Haiti and other African nations. Folks, wait till you hear the Trump administration, how they are using the pandemic to make money. It is shameless what they're doing. A huge scoop of the New York Times also reveals how this administration absolutely failed America when it came to handling this pandemic. Also, more on why the African American community is contracting the virus at a higher rate and how to assure equity in treatment. Florida inmates are being used to make masks, but they won't be allowed to use them. So they're making masks for guards, but they can't use the very masks that they are making. Plus, black-owned businesses are facing major challenges in getting federal assistance during the lockdown. We'll talk about ways around it. And a black doctor who was helping homeless people gets handcuffed by cops in Florida in front of his house. We'll explain why. Time to bring the funk on Roland Martin Unfiltered. Let's go.
He's got it. Whatever the biz, he's on it. Whatever it is, he's got the scoop, the fact, the find. And when it breaks, he's right on time. And it's rolling. Best believe he's knowing. Putting it down from sports to news to politics. With entertainment just for kicks, he's rolling. It's Uncle Roro, y'all. It's Roland Martin, yeah. Rolling with Roland now. He's funk, he's fresh, he's real, the best, you know he's Roland Martin now. Martin.
Folks, the White House is currently holding their coronavirus press conference. Donald Trump is speaking. You know we're not going to carry it because he's frankly lying all the time, so it's not going to happen. As of today, there are 566,654 cases of COVID-19 in the United States in 3 U.S. territories. At least 22,877 patients with the virus have died. That's 4,843 more than at this time on Friday. 33,743 people have recovered. In his daily briefing, New York Governor Andrew Cuomo talked about the reopening.
Where do we go from here? Question of reopening, which everyone wants to do and everybody wants to do yesterday. I am at the top of that list. We have to understand on the reopening, as much as we have this emotion, we want it to happen and we want it to happen now, and we can't take this anymore, and everyone feels the same. It is a delicate balance. Remember what we have to do on reopening. And remember, it has never been done before. None of this has been done before. So anyone who says to you, oh, I know what we should do. I know. Yeah, you don't know because nobody knows. And that's the one thing that we have learned over and over again. And this place has never done this before. Also, you look around the world, you see warning signs from countries who have opened. And my point is to our team, I want to learn from those other countries, frankly. And I want to make sure we know from our studying and assessment of what's going on in other countries that what worked, what didn't work, and let's learn from those lessons. You can now go back and look at Wuhan province and look at Italy and look at South Korea and see what they did and see what worked and what didn't work. So let's learn.
Folks, civil rights groups sent a letter to members of Congress asking that they address 2 major provisions of the proposed COVID-19 relief bill that would exclude millions of immigrant families, including U.S. citizen children. Immigrants are frontline workers leading the response to the pandemic in places like public health, agriculture, food prep and delivery, and cleaning and maintenance. Joining me right now is New York Congresswoman Yvette Clarke. She is the chair of the Immigration Task Force, and whose Brooklyn district is largely made up of immigrants. Before I talk about that, Congresswoman Clarke, right now, happening at the White House. It's one of the most shameful, despicable things that we have seen. Donald Trump is literally bitching and moaning about media coverage. Now they're playing a video as we speak where he is complaining about the media's coverage. There's not been, so far yet, a single update on the coronavirus. It's all about his ego. It's all about this back and forth with Dr. Fauci, whether or not he will fire him, even though he retweeted something this weekend. I mean, I have never seen a more shameless, despicable human being occupy the Oval Office than Donald Trump. And what's happening right now is beyond shameful.
Roland, we have to do all of the work for our communities despite what Donald Trump is saying and what he is not doing. It is critical right now that we focus our attention on saving lives in our community. We cannot be distracted by the Donald Trump show. He is inept. He is out of step. He is out of his league and he's in over his head. We have to look to the leadership of others within the administration, outside of the administration, and in the communities in which we live, because right now, again, he is purely a distraction in this time of an emergency crisis.
Well, there's a reason why we do not show, when he is talking, we do not waste our time showing anything from his news conference because it serves no value whatsoever. If Dr. Birx or Dr. Fauci are not at that podium, then we don't play it. And so that's why we do that on Roland Martin Unfiltered. That will always be the case. If anyone disagrees with that, that's tough. It's my show. But that's the call we'll make because this man lies way too much for us to keep giving out the information to our audience. One of the things that has happened. Go right.
It's dangerous, Roland. If he continues to be misleading to the American people, lives are on the line as we speak. Every hour that goes by in New York City, I'm hearing more and more sirens racing through the streets of my community, out there on the front lines trying to save lives. We don't have time to deal with this man's narcissism. We have to focus our energies on saving human life in the very neighborhoods and communities in which we live.
One of the things that is happening is the impact on immigrants. We had a guest on Friday, Johanna LeBlanc, talked about what is happening where they're sending people back to African nations. They sent back 68 Haitians as well. Members of Congress have said, stop doing this because you could potentially be spreading the virus there. They're not actually checking these folks before they leave. And so how they are treating immigrants during this crisis just goes to show you this anti-immigrant administration.
Well, this has been part and parcel of what we have witnessed from the day that Donald Trump was sworn in, and even before then when he came down the golden escalator. But now it has far more implications beyond just, the rhetoric, the ICE raids and everything else. It really means literally life and death. And as long as we have this virus in the Western Hemisphere, whether it's the United States, it's the Caribbean, it's Latin America, we will never be rid of the scourge of COVID-19. So it's foolhardy for him to do through his administration what he is doing. The sad part of it is that real lives are on the line. And at any point in time, we send individuals who are infected with COVID-19 into these very fragile developing nations that don't have a fraction of the healthcare infrastructure that we have here in the United States. We are in for a disaster in the making. And so I would really appeal to the State Department and those people of goodwill to really address this issue of deportations at this stage while we are still combating this virus, while we are still looking for a vaccine that could perhaps make sure that we can save lives. There's so much work that we need to do in terms of focusing on the United States population, those within our families and our communities, and making them well enough so that traveling doesn't become a dynamic where we are actually exporting and importing people, infected persons in and out of the United States of America.
One of the things that we talked about is that the reality is there are a number of people who are immigrants who are working on the front lines, who are essential workers, who are working at grocery stores, who are working at convenience stores. All of these people who are working in the medical field, all of these people who have ignored folks like this, have trashed them. It's amazing how millions of Americans are coming to depend on them.
Well, again, our economy is fully integrated, and we've just been in denial about who provides essential services in the United States of America, what the makeup and demographic of that workforce looks like, sounds like, and how they're able to be effective in our society. And we've not given them the credit nor the status that they deserve in our civil society. And now we are all paying a price for it. Because again, as you stated in the opening of your show, Roland, these are individuals that live in blended communities and blended families. Someone in the family is a citizen, could be a child, could be a sibling. Someone in the family is a resident of the United States. They have a green card, in other words. Someone may be a DACA recipient, a recipient of temporary protected status, or just be in between status, period. Someone has filed for them. They're here in the United States awaiting for that filing adjustment. There's so many ways in which we have not addressed residents of our communities who are immigrants, who are in between status, and who are the most vulnerable. We have vulnerabilities, but when it gets to the point where you have a program being rolled out that has no provision whatsoever for the health and well-being of individuals we know live and work within our communities, we are opening ourselves up for the constant spread and circulation of this virus, because these individuals will be hardest hit, will be hesitant to go and seek treatment, will be food insecure, because indeed, if they don't work, they don't get paid. And those that are working as essential employees are not getting health care benefits, are not receiving PPE, the personally protective equipment to be able to interface with the public. And we have, again, a circular disaster that is taking place with respect to the health and well-being of these individuals in particular, but our entire communities in its totality.
Last question for you. New York Times had a big piece over the weekend detailing the faults and failures of this administration. What was stunning to read is how they are essentially, actually NBC News had another piece talking about how they're basically aiding and abetting corporations, where the United States is paying for chartered flights for DuPont to get their material overseas a lot quicker, and then bringing it back on chartered flights paid by taxpayers. PPE would normally be costing $5, and then they're selling it to the United States for $15. And then so how in the world can taxpayers be footing the bill to make PPE faster and be paying 3 times more?
It's a criminality at a whole nother level, Roland. Unfortunately, the Congress is not in session to be able to do the type of official oversight that we need to do to make sure that we hold the Trump administration accountable for taxpayer dollars. We were actually just talking about that on one of our caucus calls just a few minutes ago. The issue is profiteering. We're seeing it across this nation, how the Trump administration is using the private sector to essentially drive up the cost of products that we need in order to arrest this virus, whether it's PPE, whether it's testing materials, so that they can profit from this before it even hits the ground and hits our communities, draining the coffers of states and localities that cannot afford to purchase these products because they're being price gouged. It's really a sin. And we know that this is typical of what we can expect from a Trump administration The challenge is now holding them accountable for what they're doing because, again, they are scamming the American people in many ways, profiting off of price gouging and setting up a system through which private interests are benefiting tenfold over taxpayer dollars for essential materials that we need to save life, to preserve life, and to get through this crisis. It's really a shame and it's a disgrace. We can't say that enough, but we're going to have to hold this administration accountable. Right now, we are in the midst of this pandemic. We are still in the emergency crisis phase. We're trying to move to relief phase, and that phase is being corrupted, unfortunately, by the Trump administration.
Congresswoman Yvette Clarke of New York, we certainly appreciate it. Thanks a lot.
Thank you for having me, Roland.
All right, folks. I want to go right down to our panel. Robert Patillo, he is Executive Director of Rainbow Push Coalition, Peachtree Street Project. Amisha Cross, political analyst and Democratic strategist. Michael Brown, former vice chair of the DNC. Michael, I want to start with you. We've talked about constantly in the failures of the administration. To read those two stories over the weekend, to read the NBC report, to read the New York Times report, to see that DuPont, in order to speed up the process, the United States taxpayers are paying for private charters that cost $1 million when we actually have access to Department of Defense planes that cost $10,000 an hour to fly these Tyvek, the material, to have them assembled in another country, and then we're flying them back. And then the federal government is letting DuPont keep 60% of what we're helping to pay for, and only 40% is going to the government, but we're actually paying $15 per PPE that normally costs $5. How in the hell is the federal government, Donald Trump, Jared Kushner, Mike Pence, they are aiding and abetting American companies ripping off taxpayers in the middle of an international pandemic?
Well, as you know, Roland, we probably should not be surprised by any of this. This is how this administration acts. This is how they conduct themselves. And with all due respect to my good friend from New York, the oversight to this administration, they ignore oversight. There's nothing you can do. They're not going to provide any documents. They're not going to be honest about how they've run their administration. You're going to have to, as we've talked about many times, when you're talking about bringing a knife to a gunfight, you're always going to lose. We have to bring a gun to a gunfight when it comes to oversight. Start turning off their money when it comes to their offices. Start doing things that they will feel, but they don't care when they get a subpoena. But this is how they act. This is how they're going to act for the next, 9 months or so. And then they're going to be out of office because President Biden will be coming in.
Amisha, here's an actual quote from the NBC News story. Hear me, go to my iPad. We actually helped get raw materials supplied from Richmond, Virginia, and we flew that shit to Vietnam, all so that DuPont could sell us their products, said a senior official involved in the coronavirus effort.
Just circumventing the process. What Donald Trump could have done, and what I think any president worthy of their salt would have done right now, is to convert a lot of our private sector leaders to actually supplying and being able to create a lot of what's necessary to fight COVID-19. What we've seen him do is essentially go rogue, to use private sector leadership to assist him in that process, and to be a modern day pirate when it comes to actually going and interfering in getting supplies from other nations, literally having them taken off of boats as they were being shipped to other places. So I think that this president, he's showcasing exactly who he is. We're watching day in and day out him totally create an even stronger mess of what is COVID-19, and nobody should really feel at ease right now.
Robert, to watch what is happening is stunning. The New York Times had a big piece over the weekend that showed the levels of incompetence, where they got the emails of many of these folks who were corresponding back and forth, who were saying in mid-January, this is going to explode. This is going to explode. we have a problem. Then they even had one email where a CDC official said, wait a minute, if this is correct, our models are completely wrong. To watch right now, Donald Trump is at the podium, whining, complaining, showing some crazy video. He is trying to rewrite history. It is undeniable. It is undeniable that these people absolutely, positively failed the American people. More than 22,000 people are dead, and they think it's a success if less than 100,000 people die.
Well, to do a quick throwback, remember the articles of impeachment versus President Trump. One of them was failure to cooperate with Congress, obstruction of Congress. What this administration learned from that process was they have absolutely no reason to turn over documents. There is no congressional oversight over anything that they do. There's nothing that the Congress can do to constrain anything that they attempt to do. They can rule by fiat. So right now we're seeing an intersection between Keynesian economics and Friedman's concept on a large free market, where the free market is able to use government spending to stay afloat and line their pockets at the expense of the American taxpayer, running up massive deficits which do nothing to increase employment and simply line corporate stockpiles. So we have to have a Congress which is ready to hold these people accountable, to have hearings, to do not be afraid of being on a video at President Trump's press conference, but to really have oversight over what's going on. We just gave the president a $1.5 trillion blank check where we don't know where any of the money is about to go, and we're ready to hammer through another $500 billion in spending. And if we don't have oversight, we're going to be paying this off from our grandchildren and great-grandchildren going forward.
To watch all of this play out makes it perfectly clear that if you vote for Donald Trump in November, you have no brain whatsoever. That what you're seeing is a true thug. What he did here was he got with the Chamber of Commerce said, no. Do not employ the National Defense Production Act. Don't do that. Basically, what they're saying is let big business make all the money that they can. Here we have nurses in New York and Massachusetts complaining about lack of ventilators. And what Donald Trump is doing, he is using the federal stockpile like pork barrel projects by saying, okay, they told Colorado not to stop your request for ventilators. Then he turns right around and says, after getting a phone call from Senator Cory Gardner, Republican, I am sending 100 ventilators. And then he doles out another set of ventilators, Michael, to the senator from Arizona, who's in a very tough re-election. He literally is playing with the lives of Americans based upon who I can dole them out to as if they are pork barrel projects.
You're right, Roland. And first, also, let me apologize to you and to your listeners. The pollen has wrapped around my vocal cords. It's that time of year, so I apologize.
I understand. We understand.
I think you can hear me okay.
Yeah, we got you.
As we talked about last time I happened to be on, we talked about that he's playing red state and blue state politics. He does that with everything, whether it's impeachment, whether it's in infrastructure, which has not gotten off the ground. Now, with COVID-19, everything is about who's a red governor, who's a blue governor. Andrew Cuomo keeps talking about me. But if you notice, there are a lot of Republican governors who are also not pleased with how he has been conducting himself. Now, the ones deep in the trenches with him, they will always defend him. They won't keep people at home. They want to keep their businesses open because they want their economies to be okay come November, so he can say, look, in Kentucky, well, Kentucky's a bad example because you have a Democratic governor. But the governors you just mentioned that happen to be Republican, they can say to their voters, support Donald Trump. The economy's great in our state. Don't worry about what's going on in the rest of the country. Focus on what's happening here.
We can just simply not deny what is happening here. He can play all the videos that he wants to, Robert. He can push this stuff out. But what Donald Trump cannot do, now, granted, let's be honest, he throws out fake news. In fact, it was hilarious to watch the White House blame the media for the fire of Fauci stuff when it was Donald Trump who was the one who retweeted somebody who were saying fire Fauci. And what you have here is somebody who is he's not just a known liar. He will lie about a lie. And there's nothing you can trust that comes out of his mouth. And so he is going to play this game. And unfortunately, his supporters are some of the most gullible people you've ever seen. And they will fall for the lie and the okey doke every single time and swear he is the greatest thing since Jesus. In fact, they actually believe that he's probably even more important than Jesus.
Well, one point I wanted to circle back to is when you were discussing the patronage with the ventilators. I don't think we've done a great job explaining to people why the ventilators are so important. The way that the COVID-19 disease works is that you have a RNA strain which reproduces and therefore attacks the alveoli in the lungs, which triggers a cytokine storm, which triggers inflammation and fluid within the lungs. As the lungs try to push the fluid through the system, just like when you're lifting weights with any muscle, they wear out and can no longer operate on their own. Without these ventilators, which cost between $25,000 and $50,000, and now with interstate bidding, sometimes up to $75,000 per unit per ventilator. The only thing that it can allow a person to maintain respiration long enough for their immune system to fight off the virus are these ventilators. And even with that, 70% of people worldwide who go on to ventilators end up dying from the virus of the number of people who have recovered thus far. So when we talk about giving out ventilators based on political preference, you are literally deciding life or death. It's not as if these people just want this as a luxury item or if it's something nice to have. And then there's these discussions about manual ventilation, which causes a barrel disease where you rip the lining of the lungs and the person dies anyway. Or when they talk about splitting the ventilators, what you have to do is put both parties into a comatose state so that their bodies can be on the same rhythm with the ventilator in order for them to split that ventilator. So we have to have these apparatuses in production. We have the Defense Production Act, where we could have put in place in January to allow some of these industries that have the ability to take publicly available plans, retool, and get them out there to the public. But instead, we're doing this dog chases its tail thing, where we, for some reason, do not want to believe in medical science, do not want to believe the research that comes out, and we're so busy talking about magical pills and voodoo prescriptions that are going to magically save everybody that we aren't doing what we know is actually effective.
Amisha, what people need to understand is that what we are facing right now is a dysfunctional government that is favoring the rich over those who are in need. We have a government led by Donald Trump that truly does not care about people. This is a man who will stand at that podium, will not say anything comforting to the people who have lost lives. 4,000 more people died since this point Friday. That means a 9/11 tragedy happened over the weekend, and all this man can do is to stand at a podium and bitch about his media coverage. Like right now, I believe this briefing started at 5 o'clock. The tweet said, the briefing was at 5 o'clock Eastern. Right now, it is 6:31 Eastern, which means they have been talking for an hour and a half and no real coronavirus update. It's all about his ego.
The numbers are what they are, and this president cannot reshape or redefine what's happening in this country. So he would rather use his attacks on the media. That has been his focus for a very long time. It was his focus when he was running for election. It's been his focus since he got to the White House. His favorite news channel is now OANN, One America News. He is no longer a fan of Fox, and he is utilizing them and their platform to help to rally his base. He wants to take as much attention off of his poor leadership and his response to COVID-19 as possible. He is attacking, and as you stated earlier with his retweets, that was a direct attack and a level of support for the removal of Dr. Fauci. He is someone who does not want to give the governorship in the governor states where it's actually working. He doesn't want to give them credit for the work that they're doing. He also he wants these states to have to compete for federal attention. He wants to be the president who only helps those who he considers his friends. If you are a Republican who has fundraised, who has said nice things about him, you can expect to see your ventilators. If you are not someone who has been on that side, then you can expect to suffer and your people will die. That is essentially what President Trump is telling America. he gets to pick and choose who is worthy of living and who is worthy of dying. And right now, he feels as though if you're not a Republican who has stood by him and who will carry his water, then you don't matter. If you're a Democrat, you definitely don't matter. And we're watching, the fallout across communities of color, immigrant communities, and communities across the United States.
All right, folks. And again, an ad posted on social media reminds us who we're dealing with in the Oval Office right now.
It's midnight in Washington. The lights are finally going out in the Capitol after a long day in the impeachment trial of Donald J. Trump. You can't trust this president to do the right thing, not for 1 minute, not for one election, not for the sake of our country. You just can't.
Bing, bing, bong, bong.
He will not change, and you know it. History will not be kind to Donald Trump. I think we all know that, not because it will be written by never-Trumpers, but because whenever we have departed from the values of our nation, we have come to regret it, and that regret is written all over the pages of our history. If you find that the House has proved its case and still vote to acquit, your name will be tied to his with a cord of steel and for all of history. He has betrayed our national security. He has compromised our elections, and he will do so again. You will not change him. You cannot constrain him. Truth matters little to him. What's right matters even less, and decency matters not at all. We have proven Donald Trump guilty. Now do impartial justice and convict him.
While we air that, well, Donald Trump is actually suing local TV stations for airing ads such as that because he doesn't want the people to actually see and know what he's actually done. As we've been saying on this show, the documented health disparities between racial groups in the U.S., including higher rates of chronic diseases and lower access to health care among blacks compared with whites, is making some African Americans more vulnerable to COVID-19. Joining me right now is Dr. Sidney Coupe, internal medicine physician and founder and CEO of Coupe Quality Clinic in Fort Lauderdale, Florida. And so, Dr. Coupe, you've been studying, working on these type of issues all across the world. And so, just what makes it different when it comes to African Americans? What's happening here?
Yeah, well, Roland, thank you so much for the opportunity and the platform to share with everyone. As you know, health disparities is not something that's new to us. It's something that we've been dealing with for decades, actually. And we know a lot what's causing health disparities. And it's important for us to understand what health disparities is, because a lot of times we throw these sexy words out there and we just don't really get a good sense on what they are. But for me in the front lines, what that means is that there are people who are dying, that there are a group of individuals, African Americans, for instance, and Latinos, they're dying more than their counterparts in the same situation. They're getting sick more than their counterparts in the same situation. And I'll give you an example. Someone with high blood pressure. We know that high blood pressure causes kidney disease, heart disease, strokes. And in the African American community, we're almost at 40% more likely to suffer from high blood pressure than our counterparts in America. So this is definitely something that's concerning. And so when you're looking at in the spectrum of the COVID-19 pandemic, all it does is it shines a light on the disparities that we have already had in our country. So for me, as a primary care doctor, and Roland, I deal with this every day. The fact that I'm a Black physician in this community in itself is addressing health disparity, because I'm likely to provide the best care and the quality care for someone who looks like me. And studies have shown this already. And so there are other things that we need to look at in terms of addressing health disparities. But in the setting of COVID-19, the issue is that we expected to know that us in African-American community, as well as Latinos, we would probably be the ones suffering a lot more because of these existing health disparities and healthcare disparities in specifically, which is the services that's provided to them. And it's sad to say is that because of our race and ethnic background, it's proven that, we don't get the best care that we deserve. And so when I hear about this health disparity discussion, it's a very complicated and complex conversation that requires a lot of different disciplines. But for a physician, I believe that what we can do is making sure that every single African American, Latino that comes to our office or I see in the office or in the hospital need to get the best care that they can get. And so, Roland, for me, health disparities is something that I think we can address. And that's the culprit on why a lot of our people are dying in the community from this COVID-19 infection. And a lot of them are getting more sick than they really need to be. And so when you have diseases such as obesity, high blood pressure, diabetes in our community, therefore, this put these people at higher risk of getting infected and worse, getting into severe illness with the infection.
Do you think, you heard Dr. Anthony Fauci, you heard the Surgeon General, Jerome Adams, you heard them talk last week. Do you actually think that this country has the guts to actually deal with this issue? It's no different than what we're seeing with what coronavirus has exposed to everybody when it comes to the gaps in our education system. It's no different than what we're seeing when it comes to people who are now depending upon essential workers who are not even getting paid a living wage. It's no different than what we're seeing when it comes to so many things that this coronavirus has shown us. Will this nation use this moment to deal with this issue? Do you actually have faith that leaders will?
Well, Roland, I have no choice but to have faith. Okay, I have no choice but to have faith. And in fact, if we don't have faith, then there's no point. I do believe that this is an opportunity that we have. We have an opportunity to look at these disparities that we're noticing. We have an opportunity to look at the folks who are more vulnerable in these situations and to actually do something about them. I can tell you from where I stand, I try not to wait for others to do for us. We have to do for ourselves. And so for me, in my community here in Fort Lauderdale, we decided to take matters in our own hands. And we started our own task force to address where are the needs and where are the gaps around testing, around people getting the treatments that they need. And access to healthcare in general is a big issue in our country. There's a lot of people who are uninsured, people who don't have or underinsured, who don't have all the care that they need. And there are people who have, no documentation for them to even exist in our country so they can get the care they need. So there's a lot of issues in terms of accessing healthcare. So for us here, we decided to develop a membership model, which we call direct primary care. And this model gives people access to basic primary care that they need for them to live a quality life. And because I'm able to do that here in my small ecosystem, that's how we begin. And, previously the representative talked about communities, focusing on our communities. This is how we have to be able to win this game against health disparity and ultimately against COVID-19 pandemic, is to look at our communities. What are we doing? Supporting the folks down there in the front lines, either the local policymakers or local, health techs, doctors, nurses. We need to support them and looking at how they can better do their work more effectively and more efficiently. And if we do this one person at a time, one community at a time, I believe we can address health disparities. And as I mentioned before, here in Fort Lauderdale, we've been addressing this for quite some time. I've been working for over 10 years with an ethnically and linguistically diverse community here in Florida. And so to be able to support them in the way that I do, to provide them the quality level of care that they need and they deserve, this is exactly what we need more of in order for us to address this long term.
Well, and also what has to happen, this is the final point for you, what has to happen is you need nation's leaders listening to Black doctors, listening to people who are quite familiar with this here. We had a doctor from Harry on last week when Dr. Fauci said they were just learning that asthma was an underlying threat or condition for coronavirus. And we came back from the news conference and the doctor said, y'all, they could have asked any Black doctor anywhere in America and they would have told him that. And this guy said, we've been yelling that for 5 weeks here in Nashville. He's like, maybe next time listen to him at Harry Medical School.
You know something, Roland? Great point. One of my theories is that I don't speak to people who don't have skin in the game, right? So these folks who go up there and theorize and give them their opinions, that's fine. But for right now, I can tell you, your platform is giving us an opportunity to share, an opportunity to speak up. Because what's happening as practitioners, we're the ones that have the unique perspective that will eventually address some of these concerns and these gaps that exist. And so absolutely, I think, you could ask any Black doctor working in a diverse community will tell you asthma, high blood pressure, diabetes, those are the things that's running rampant. And one last thing, when you think about prevention, and when you hear data such as, close to 30%, over 30% of Black women die from breast cancer more than white women do. That's staggering. That's disturbing for a doctor, for someone who's in healthcare. And so what can I do? And what I've done for that is that I've screened all the Black women in my practices. So these are some of the things that I can do in my ecosystem. But again, Roland, as you previously alluded to, this problem of health disparity, it requires multiple disciplines, requires policymakers, requires business folks. We all need to work together as a multidisciplinary unit in order for us to address this. But again, we need to start somewhere. And if everyone does their part and you create these platforms for us to speak up in what we see in the front lines, and this is how I think ultimately we will win this game against health disparity.
Well, Dr. Gupay, we probably had in the last 5 weeks some 60 different guests on this show. Nearly all of them have been African American. Y'all are not hard to find. I have no idea why MSNBC, CNN, Fox News, ABC, NBC, CBS, and the rest of these people seem to make it so hard. But when the White House last week talked about what's happening with the Black people, and then when the New York Times put it on the front page, it was real easy to find Black doctors. Part of that, and let's just call it what it is, part of it also deals with the bigotry and the racism that exists in mainstream media, where they only see us when it's a Black story, but they don't think to actually have Black experts who could have been talking about these things, because y'all can also still talk about just stuff beyond Black people. I mean, the body is the body, health is health. And I think had mainstream media done that, they would have heard African-American physicians and doctors and scientists raising these issues in February and March and not waiting for a White House news conference in April. That's
Roland, great point. And I have to tell you, and I'll share this personal story about me, for instance. I'm Haitian American. Mm-hmm. I was born in Brooklyn, New York, by Haitian immigrants. My parents sacrificed their entire life to give me and my family, my brothers and sister, a great education in America. And I've devoted my entire career in terms of believing in creating a possibility that did not exist from my lens, which is that everyone deserves quality care no matter where they live. And that is where I stand. And so you can tell based on my track record and everything that I've done, I've studied and I've got a public health degree, I have health policy degrees. I've educated myself appropriately to understand the issues. And so absolutely, I can certainly talk about the issues from different perspectives. But again, I think this is about humanity. And if we cannot address issues about humanity and identifying people for who they are in terms of what they can bring into the conversation without actually identifying them with a race or an ethnic group, I think we could probably do ourselves a favor. And so I absolutely agree with you, Roland. I think you made a very good point. I think we need to look at what is the issues around why isn't there a representative or of the people that look like us. And as a doctor, I'm a role model. I remember going back to Erasmus High School in Brooklyn, New York, speaking to the kids there and letting them know that they too can become a doctor. And so as a role model, it's important for me to be visible. And again, I can't commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having, Roland.
Well, that's why we do it. Dr. Gupay, we certainly appreciate you joining us. Thanks a lot.
Absolutely. Thank you.
All right, folks. And again, for those of you, this is why we do what we do. We need you, of course, to support what we do. Our Cash App is $RM Unfiltered. PayPal is paypal.me/R Martin Unfiltered. Your support is critically important for us to keep doing what we do every day. We're not here just to do a one-time special or just to do it every now and then. Every single day, we are here giving you the kind of coverage that you're not finding anywhere else. One of the issues we've also been focused on is what happens when it comes to Black business having access to various contracts. Well, there's equity in that treatment. Remember, we did the story where Congresswoman Bonnie Coleman, as well as the National Urban League and others, complained that the Trump administration was suspending the affirmative action provisions in place in the Department of Labor. Well, there are Black-owned companies who are providing services, but they can't even get access to what's happening in the federal government. But of course, if you're DuPont, you can make millions and millions because you got access. Joining us right now is Reginald Swift. He's founder and CEO of Rubik's Life Sciences. And Reginald, glad to have you here. You have been having difficulty trying to get access to procurement, and you have products that can actually help people in this moment. Please share with us what you've been dealing with.
Yes. Thank you so much, Roland, for having me on the show. I definitely agree with the sentiments of Dr. Coupe of making sure that we have a continuum of care. And that starts with the innovation itself, right? We are an innovative company, our research and development, and we focus on really how do we make sure that we design personalized care for people of color and minorities to efficaciously create better health outcomes. So what we are looking to do, right, not just from a service side, but also product side, is being able to support many of the physicians, the doctors, NIH, federal agencies on specific activities and products and consumables that they actually need to be able to mobilize their ways of testing. And we've been, having our struggles early on with the CDC when we first detected the coronavirus that came up ashore from from overseas to the U.S. And many of our struggles have been really toward not just informing the federal agencies, but also mobilizing in ways that we can stand up policy and devices that can actually put these things together. Mind you, we actually created a specific mask that could detect 2 strains of the coronavirus back in January. And this was when we first started on identifying the strain level from what we saw from the animal models.
But hold on. You say your company has created a mask that you can put this mask on and it will detect the 2 strains of the coronavirus? That's
correct, yes.
Wow.
We've done that, and we actually retrofitted one of our devices that we actually had back when a friend of mine was diagnosed with cancer, lymphatic cancer. He unfortunately passed away before we actually had the opportunity to get it into clinical trials. But we used that platform to retrofit the innovation to then target towards COVID-19 or coronavirus, for as many people know. And many of what we actually are doing is to say not just we are able to invent these things, but we're also able to source consumable product that 3M is making, that many other organizations are making, that are on the market, and we can help communities of color at the same time. And just as Dr. Coupe said, we mobilize our own way to make things happen for us, not just wait for them to make, to drop down the bullet to say, now we're ready to give you some opportunities. We're just doing it on ourselves.
What about testing? Any luck whatsoever there in trying to get to the CDC, to get on the federal level to assist with that?
So I'm glad that you asked. So many of what we're actually accomplishing is not just being able to just network with the CDC, but we're also focusing on obtaining material. We actually have 1 million tests available that we can actually go into the communities right now and test 1 million people. So we're not waiting for the CDC to come to us to say, okay, can you disperse your product to many of the communities that need it? Because what we saw is that many of the resources that they do have for the Defense Production Act aren't going to Michigan. They're not going to Chicago. They're not going to Louisiana. They're not going to many of the majority states that have the majority of African Americans. So we're mobilizing our ways to get into these Department of Public Health groups to say we're here and we're here to help you. So and we can stand up a million tests.
So y'all have, okay, so explain. So you say you have 1 million tests. You have the ability to administer and process them?
So yes, we can actually mobilize both from a processing standpoint and as well as a detection standpoint on being able to say whether you have COVID-19 or not. And it was actually we got lucky because it actually came from a connection of ours from the Air Force in which we were able to source 1 million of these test kits. So we have 1 million in our shelf right now that we're ready to just mobilize it and get it ready for people who actually need it.
So y'all have right now 1 million tests for COVID-19 that you can administer and process?
That's correct. Yes.
Wow.
That's correct. And
you haven't been. So what happened? Do you need to get approval from CDC or so?
No, so I'm glad that you asked. So the products in themselves are already approved by the FDA.
Okay.
So we don't need to have any specific direction from the CDC to mobilize any contingency to stand anything up. All we need is to have collaboration between a physician network, healthcare provider network, and just people who actually want to mobilize people to really get tested. That's all we're waiting for.
Wow. And so when you hear Donald Trump a month ago in the Rose Garden say, we're going to have drive-through testing at CVS, Walgreens, and Walmart parking lots, but then we don't see it, that surely you're like, wait a minute, we're ready. What are y'all going to do?
That's right. That's right. And one of the things that we realized up front, and as we logged on and we became a part of the White House task force, and we're on the task force as well. We realized that many of the sentiment and the intent of what we expected to happen wasn't going to go in that direction. So we wanted to then shift our gears to say, let's mobilize community action and community groups that want to be able to say, listen, from a person that is actually on the ground, boots on the ground, that have done this work before, we've actually done this type of mobilization overseas. We did this in India. We did this in Nigeria. We did this in Morocco for infectious disease. So when we're looking at, the issues here, we're confused as to how we can't even get in front of the right people to really help mobilize these tests, because we've done it effectively overseas for infectious disease, for even ones that you have to put a suit on. We're talking about the whole suit from head to toe.
Questions for my panel. Who wants to be up? Amisha, Robert, and Michael. Who's got a question?
I do.
I'll go.
Amisha, go first.
I think I'm extremely interested. Well, first of all, thanks for all of your work. I'm extremely interested in the testing project you're doing with the mask specifically. Why hasn't is that something that you're looking to have mainstream to catch on with some of the national organizations? Is that something that you've had conversation with around pushing with the CDC? How does it work, beyond the work that you're doing?
No, of course. So we actually have one prototype, and this was of the mask, right? So one of the things that we actually did back in January was we sent this mask out to the Philippines, and we got enough data points to say from a efficacy level or how much does it work towards detecting this strain or two strains. We saw from 44 different patients that it did, at least from 96% of the time, it detected it correctly and it detected it accurately. So once we got enough of those data sets, we're compiling the report as we speak right now so we can send it to the FDA so we can get this prototype approved for Emergency Use Act. So once we are able to do that, we're looking to scale up the manufacturing of our prototype to then design it in a way that many, many other groups can use across the nation, not just focusing on what we're doing here, because it's no good on the shelf.
Michael.
First, congratulations for all the great work you have done.
Thank you.
How do you do how have you monetized the kits? Is it proprietary? You can't tell us how much you charge, or how does that part work?
As far as the kits that we're able to source, it's as competitive as many of the other kits that we have right now. I mean, as you can see on the market. So it's not really proprietary. It's really just the same amount that we could charge. But again, these were already bought and paid for because of our connection with the U.S. Air Force, and because there was a direct link to say they were actually going to try to mobilize these test kits, but eventually that became a part of the surplus. We now have 1 million in stock that we just need to use.
Robert.
Got it. Thank you.
Yeah, with regards to your supply chain issues and regulatory issues, who have been the partners you've worked with in both the legislature and the regulatory offices in order to try to fast track this? What we saw was when the president heard about hydrochloroquine and chloroquine on Twitter, for example, all of a sudden he was able to push that through into wide-scale testing almost immediately. Who have you been working with, and who would you like to work with in order to put more pressure to get this fast-tracked?
Well, I'm glad that you asked. So we have a lot of a lot of great collaborators. We actually, I made some great made some great friends from UVA, Dr. Ebony Hilton and Dr. Leanne Webb. They're helping us mobilize opportunities within the hospital provider supply chain within the Virginia legislature and the groups down there. For us, it's been a struggle because we've actually tried to interface with with Ayanna Pressley and Senator Elizabeth Warren. Yet, it seems to be a slow traction of trying to be able to get them in front of us and say, listen, this is what we did.
Hold on.
You're
trying to reach Congresswoman Presley as well as Senator Warren to do exactly what?
So we're trying to be able to mobilize from their standpoint how they can help push our vehicle forward so we can get into many other states, as well as being able to use the resources of Massachusetts so we can use our testing kits to get into communities like Lawrence, Massachusetts, or Dorchester, Massachusetts, or Jamaica Plain to really stand up programs to get our testing kits available to these guys that are in need.
So one second, you've been able to get into other states, but you have issues getting into Massachusetts.
Yeah, ironic, isn't it?
No, that's fine. First of all, you understand that ain't nothing but a text message. So I just want to be clear: you're trying to get into Massachusetts, and you're trying to get access to Congresswoman Presley as well as Senator Elizabeth Warren, right?
That's correct. Yes.
Okay. All right. Well, they ain't nothing but text message. So, but go ahead with your answer. Go ahead.
Okay. No, I definitely appreciate it. And we actually tried to mobilize an opportunity within Detroit and as well as Chicago. But yet we face a lot of higher scrutiny to be able to mobilize what the same drive-through types of activities that 3M and many other pharmaceuticals companies are able to do. But for us, it seems to have that slow walk to approval. So one of the things that we've been able to do is to try to find a way to work with many of our collaborators to help mobilize ways to get in front of individuals that, such as yourself and many of your panelists.
Well, here's what we'll do. This is just real simple. What we'll simply do is we'll just simply connect you with Congresswoman Karen Bass, who's chair of the Congressional Black Caucus, and then again, all the CBC members are there, and so that's very easy to do.
Oh, I appreciate it. Thank you so much, Roland.
Okay. All right, panelists, any more questions?
I would just like to say if he needs any assistance, the Rainbow Push Coalition, of course, we will be glad to speak with him and making connections that we can. So if he would like to reach out to me, I'll send him my email address and contact information on the back end.
All righty, sounds good. Reginald Swift, we appreciate it, man. Thank you so very much.
Thank you so much, Roland. It's been a pleasure.
All right, folks, got to go to a break. When we come back, more Roland Martin Unfiltered. We're going to talk about this crazy story out of Florida. Inmates making masks for correction officers and not for themselves. This country has lost its damn mind. That's next to Roland Martin Unfiltered. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these Shibori pocket squares, we have them in 47 different colors. All you got to do is go to rolandmartin.com/pocket squares. So it's rolandmartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all seen me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at rolandmartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Folks, as the number of positive coronavirus cases among inmates in Florida's prisons continues to climb, some inmates who remain in good health are being assigned to make masks to prevent the spread of the virus, but not for each other, at least not at first. What's crazy, Michael, the guards get them first.
Well, I don't think that should shock any of us. Again, this is how folks have been conducting themselves. And I don't want to make it seem like it's only people of color, because it's not a race issue. It's a socioeconomic issue. So if you are incarcerated, it doesn't matter necessarily what you look like. The fact that you're in jail, you're less than anybody else. In particular, a guard. A guard needs to be protected, but the inmates don't. That's clearly the philosophy. And by the way, on your pocket squares, Roland, that's the first time I've seen that commercial. Very nice. On your website, is there like a catalog of colors?
Oh, yeah. Yeah, they got the colors, okay. But trust me, ain't that many purple and gold. I mean, there's a purple, there's a gold, and so you can buy two if you want to have your little frat colors. Amisha, what's nuts about this whole deal is, if you're in prison, why can't you buy some damn mask?
This is outrageous, but not more outrageous than a few weeks ago, I guess, we also saw prisoners making hand sanitizer. Hand sanitizer they also were not allowed to use. So we've been using prison labor for a long time to provide for things that are great for, human necessities and things that we need in times of crisis that prisoners themselves were barred from having. So this is par for the course in jails and prisons across this country. It's just really sad considering how coronavirus is running rampant amongst that population.
Bottom line, what we're seeing is we're seeing, Robert, people taking advantage of others in a situation like this as well. I'm sorry, if you're the state of Florida and you're supposed to be buddy-buddy with Trump, Governor DeSantis, you should be able to get masks for corrections officers.
Let's call this what it is. It's slavery. We have a group of people who are captive, who cannot leave, who cannot seek other employment. And for that reason, they are exploited for low-paid labor. No different than being paid for picking being paid a small amount for picking cotton, or for being paid a room and board for working a sugarcane plantation. This is modern-day slavery, which is going on. And we have to understand that many of these people, when we think of inmates, we think of rapists and murderers and robbers. There are a lot of people who are in jail on non-violent drug offenses, for financial crimes, for all sorts of other crimes. So the idea that they should simply be stripped of all human rights as a result of them being in a state of involuntary servitude is against the fundamental natures of America. And I do think that the Congressional Black Caucus can step in on many of these things, because most police departments and sheriff departments are dependent on federal funds. They are dependent on federal funds in order to have federal equipment, to have training and other aspects of running their local departments. And if they demand that all non-violent offenders be released, put on the ankle monitors during the duration of this outbreak, or else these jurisdictions will not get federal funds, I think we'll see these things go away a lot quicker.
Folks, a doctor has been testing the homeless in downtown Miami for COVID-19, said he was handcuffed by police outside of his Miami home on Friday morning while he was placing old boxes on the curbside for pickup. Watch this video. Now keep the video going. Keep the video going. And Dr. Armin Henderson was highlighted in a Miami Herald story 2 weeks ago for his work with the homeless during the pandemic. He said the officer released him from the handcuffs and went on his way after the doctor screamed for his wife, who came outside with identification. I mean, this is the craziness, Robert, that black people have to deal with for some reason. So you are questioning who this guy is, who's doing these various tests. Under what authority do you have?
Well, we have to understand we have never decriminalized blackness in this country. That no number of degrees, no number of articles, or no amount of work can change the fact that you are a black man in America. Like, I've told this story on air before, where I was coming home from class in law school, and it was a gun to my head on the hood of a Chicago Police Department car until they saw my law school ID. So if this happens to black men in this country, it's a level of dehumanization which is meant to ultimately keep people in their place, and that is the whole goal of over-policing, to keep people in their place.
Amisha, the police chief has ordered a probe into this handcuffing of Dr. Armin Henderson, who's an internal medicine physician at the University of Miami Health System. And now here's what's crazy. Here we go to my iPad. Henderson said, quote, his biggest concern about the up-close encounter was that the cop, the Miami-Dade police sergeant, wasn't wearing a protective mask. When Henderson said the sergeant got all up in my face. And this after the police chief in Miami-Dade announced that 6 cops tested positive for coronavirus. Amisha, go ahead.
This is just completely ridiculous. First and foremost, the officer was out of line in terms of not being equipped himself, recognizing that across that policing unit, there were several people who had already contracted coronavirus. But in addition to that, I was just speaking with someone last week who was a student. There are student groups across the country that are doing street medicine. And the majority of these student groups are led by white students who are medical students who are actually working and trying to help and provide some levels of care for the homeless population. They don't encounter any of what we're seeing happen here. So I think that we do have to hone in on the fact that he was targeted because he is an African-American male, that he himself was putting himself at risk. We all know this, because you never know when you're encountering and you're doing these donations and you're building up to help people, whether or not you're going to contract this yourself. He is out here trying to be a do-gooder, to do things for a population that most people have forgotten, a population that continues to grow across America, a population that in Miami has one of the largest homeless populations in the country that is not being seen or taken care of. So I think that there's a lot at play here, and with all respect to the doctor for being able to even take it upon himself to do this type of work, it's really upsetting that even when you're trying to do good in the midst of a global pandemic, you're targeted by the police.
Michael, let me read this here. The police chief said, let me provide a little bit of context of what was going on here. We have had a litany of complaints pertaining to illegal dumping. Now, also, I want y'all to play the video from the beginning. The commissioner from that area has received many complaints as well from the constituents. There is go ahead and play the video, please. There's a cargo van that's parked in front of that home where there appears to be trash that's being offloaded. That is the genesis of the stop. Now, what's happened after that, what's being discussed, the actions taken, etc., all that needs to be investigated, and it will be investigated. Okay, but here's what I'm trying to understand. We are watching the video from the beginning. I'm sorry. How does the officer who's coming from, go back to the beginning of the video, Mike. Go to the beginning of the video, folks. Michael, here's what I find to be interesting. The officer is coming from another direction. He cannot see what's in the back of the van. So how do he know this guy's taking out trash? Michael?
Yeah, he doesn't. As usual, we just don't get the benefit of the doubt. You can imagine if that was a person of another persuasion, clearly things may have happened differently. But we don't get the benefit of the doubt here in America, as Robert was talking about. And that's pretty much what happened to this doctor. And it's a shame. And you know what's even more of the shame? Every day when you do your show, you have these crazy videos of police of white people treating black folks unfairly. It's just the nature of what's going on in America in 2020, and it's a damn shame.
Yep.
It's a shame.
Absolutely that. All right, folks, here we go to my iPad. Friday, we had Reverend Dr. Freddie Haynes on the show. This is the graphic we have of our video that's on our YouTube channel. Don't tempt God. This is Dr. Freddie Haynes to black churches. Don't tempt God and end up conspiring with our own death. Have hashtag Easter at home. Okay? Now, I talked about how I encourage folks to check your parents, check anybody, to get them not to go to church, not to tempt this whole thing. That's what I said. But I told y'all, some hard-headed people. This is the headline on the New York Post. Virginia pastor who defiantly held church service dies of coronavirus. And yes, he's black. And I called him an idiot on Twitter, and I got a couple of people who are taking exception. They're like, Roland, you shouldn't call him an idiot. That's not fair to his family. No, I'm going to call you an idiot. Bishop Gerald O. Glenn of Richmond's New Deliverance Evangelistic Church, who is now dead because this was the quote, I firmly believe that God is larger than this dreaded virus. You can quote me on that. Repeating it a second time to clap, saying that people are healed in his church. Robert, he dead. Now, here's the deal. Somebody tweeted me, said, Roland, you can't call that man an idiot for his beliefs. Yes, I can. Because there are numerous other diseases that people get, and you can't say, well, God's still bigger than those diseases. You also can't ignore the knowledge of the doctors and the nurses and the scientists in your congregation as if that don't matter. I'm sorry. If you are a black preacher and you are a preacher of any color and you are holding church service, Robert, in the midst of an international pandemic, you are a fool and an idiot, and you are threatening the lives of your congregation.
Well, Ron, because of my relationship with sin, I cannot agree with you on calling people idiots, because I'm right on that borderline between, and right now, don't know which way we're going to go depending on how the weekend goes. But one thing Reverend Jackson has pushed for the last several weeks leading up to Easter is our hashtag, which was worship in place. Trying to get pastors to understand that, look, if you have to set up an iPhone, an iPad, if you have to get the young people in your ministry to go to some of the elder people's houses to set up technology for them to be able to access their church services, it is important that we protect the most vulnerable in our community, the sick and shut in, the elderly, from this virus. Because despite what the news media had said in the beginning, despite much of the propaganda, black people are dying at a rate far higher than any other group. If you look at Chicago, where you have 70% of deaths being black folks, New Orleans, where 70% of the deaths are black people, St. Louis, where 100% of the deaths are black people, this is a deadly serious pandemic. Just last week, we've had coronavirus become the #1 cause of death in America, passing heart disease and cancer on a day-to-day basis. So many people have for a long time thought that somehow our melanin shielded us from certain viruses. But if you look at the underlying conditions in our community, the comorbidity with obesity and diabetes and heart disease associated with it, the respiratory effects of it, we look at the rates of smoking in our community, both tobacco and marijuana, this was a perfect storm to kill people in the black community. And I think we've had something like 6 or 7 pastors in the last 2 weeks die in the black church from COVID-19 related complications. This should be a wake-up call to all that, look, the money in the collection plate is not going to be any use to you if you're in a casket. And people won't be able to attend your funeral at this point because they won't be able to congregate. They'll have to watch on the live stream, them putting you in the ground, which means you could just have the live stream and you've been alive in the first place.
Amisha, he had announced that he happily violated the state order of convening with more than 10 people. He said, quote, I am essential. I'm a preacher. I talk to God. This was his church talking to the congregation on Sunday.
Good morning. Or should I just say morning? my brothers and sisters in Christ.
All right, y'all, we're trying. The volume is extremely low. Let me see if I can try to crank it up. So this is the announcement. Go ahead.
It's with an exceedingly sorrowful and heavy heart that I come to you this morning and regret to inform you that on last night, April the 11th, at 9 p.m., our father, Bishop Gerald Glenn, transitioned from labor to reward. Saints, I can't lie. The first thing I asked God was why. But Bishop has taught us that God is big enough to handle our why. Bishop has touched our lives in so many ways. We in NDEC share so many of life's most important memories with Bishop and Mother.
Michael, how you gonna ask God why? Easy. Your bishop ignored the advice of doctors and scientists, and he chose to have service. Now he dead, and his wife got COVID-19.
Well, all I can do, Roland, is co-sign with what Robert said and co-sign with what you said. And it's a shame all the way around. Clearly, we hope he rests in peace. Godspeed to his family and to his parishioners at his church. But we have to hold him to a higher standard, and he should have known better.
It's real simple. I need everybody who's watching me right now. If your pastor is dumb enough to hold church in the middle of this, you do not follow your pastor. If he or she wants to kill themselves, knock yourself out. Don't you go to church, go online, pray with people on the phone. You can video, you can do all this sort of stuff, but do not put your life on the line because some hard-headed preacher wants to say that the blood of Jesus covers me. What's going to be covering you is a body bag if you test God. Okay?
This isn't even about God at this point. This is pastors who are purposely ignoring CDC guidelines, who are ignoring rules and regulations, who are ignoring social distancing. These are pastors who refuse to go online either because they're not as tech savvy or because they honestly don't know how to turn this into a profiteering instrument. Many pastors are very afraid that if they go online, they're not going to get money in their coffers like they would in the church. And that's essentially what this is.
Period. Robert, Amisha, Michael, I appreciate y'all being on our panel today. Thank you so very much.
Thanks, Roland.
Y'all, y'all have no idea. I can't deal with this. I can't. We do not have to die unnecessarily. That bishop gonna get to heaven and God gonna be like, you ain't listened to all the doctors I sent you. You ain't listened to all the scientists I sent you. Then you just ignored the governor's edict. So the nurses in your congregation, you ain't listened to them. The doctors in your congregation, you ain't listening to. I sent you all of these people. I sent you everybody, but you still hard-headed. That's what St. Peter gonna say at the gate. That's what Jesus and everybody in heaven gonna be like, why you here this early? Because you hard-headed. Yeah, I said it. I'm telling y'all right now, do not listen to your preacher or anybody else. And also, let me go ahead and say it, all you black people who in Pensacola, Florida, who are out like it's some big-ass picnic, take your ass home. I'm not understanding what's going on. People are dying. Y'all need to be snatching your kid. We played you that video of that cop in Uganda. He ain't lying. This is crazy what is going on. It's crazy. And we've got to get people. Look, if everybody else want to do that, but black people, keep your ass at home and be congregating. Because this makes no sense whatsoever. We should not be burying people early because they stupid when it comes to coronavirus. All right, folks, let's talk about minority businesses having a difficult time securing the bank, getting with the banks to participate in the federal bailout for small businesses. Now, remember, $350 billion was passed by Congress. We know it's not enough, but minority businesses are having an even more difficult time accessing this because of the lack of relationships with banks. Joining us right now is John Rogers Jr. He's the co-chief executive of Ariel Investments. John, always good to talk with you.
It's great to talk with you.
John, one of the things, look, my brother is with the Texas Restaurant Association in Texas. I have a small business. I know many others. And part of the thing that we're seeing is you got black businesses who have business, but we don't necessarily have loans with banks. We have accounts, but like, for instance, I don't have loans. And so I don't have a loan relationship with my bank. And what's happening is these banks are favoring up their customers who actually have loans, things along those lines. And so how can you be a black business and participate in this bailout if the banks are now getting in the way?
I know it's just another challenge for our minority business community. You know, as you and I have talked about it, everywhere we turn, we don't get treated fairly. There's no economic justice, you know, in this country, no equal economic opportunity for any of us. And our businesses are so much smaller than the major white firms. We've gotten smaller and smaller over the last 40 years relative to the white firms, and we've been treated so extraordinarily unfairly. And then because we're so much smaller, we don't have the clout with the big banks. And as you know, being working here in Chicago, we used to have the two largest black banks in the country here in Chicago, and they're both gone. Independence Bank and Seaway National Bank. We used to have our own, but we've had that taken away from us too.
So what advice you give? I mean, so what happens? I mean, do we just sit back and take it? What should African Americans, what should black businesses be doing to ensure that we're getting our fair share of these dollars? Congress is probably going to have to approve another 250 or 500 billion for small businesses because the 350 billion simply isn't enough.
You know, we have to do the things that we did when we were stronger as a community. We had Harold Washington as mayor here, and we had Maynard Jackson in Atlanta and Coleman Young in Detroit. We had political power that was forcing these anchor institutions in our community to deal with us and do business with us. And as we lost those leaders, we haven't been able to keep it going. We need to support our progressive political candidates. You know, job one. When we have people like Maxine Waters, you know, in the House, chairing the Financial Services Committee, and Congresswoman Joyce Beatty, chairing the Subcommittee on Diversity and Inclusion, they're there pushing Bank of America and Wells Fargo and J.P. Morgan Chase and Citibank to do the right things because they are in positions of power. We need to have more dynamic women like that in Congress that can be fighting for us. I was on a call today with Reverend Jackson, and he's out there organizing. But as he's trying to get people to support PUSH, and, you know, people aren't signing up. People aren't writing the checks. We have to support our civil rights organizations like PUSH, like NAN, like the Urban League, so that we can be able to force these institutions to treat us fairly.
Well, and again, you're absolutely right. That's one of the things that you have done. I've often talked about you in my speeches and other places, commending that you were there. You did the exact same thing that folks did when Dr. King was in Chicago working with Operation Breadbasket, where they understood they had to fund and finance the movement, where people are out here fighting on our behalf. So, yes, your political leaders, your civil rights organizations. I also think that this is where, look, people are at home, okay? They got to be on their computers. They got to be sitting here putting this out stuff on social media, blasting out emails, calling Capitol Hill, because the reality is this here. There are 2.6 million black-owned businesses in America. 2.5 million only have one employee. To your point about us being smaller, when we had 1.9 million black-owned businesses, they were doing an average revenue of $110,000. Now they're doing an average revenue of $54,000. And so if COVID-19 doesn't just kill black people disproportionately, it could kill black business disproportionately.
That's absolutely for sure. And because we are so small, we're already on, you know, the edge half the time. You know, this is the kind of thing that's going to close down so many of our African-American businesses. I know in our industry, in money management and mutual funds, a lot of the black money managers are going to have to to disappear. And that's what's been happening the last several years, and this will be the last nail in the coffin. So, we lost Earl Graves last week.
Yep.
Black enterprise have been so important voice for black business and, economic opportunity. I'm so worried. We just are not we're not getting the opportunities to manage money for our large institutions. And what I've been talking about to leaders around the country is that you look at this bill now for the virus and all the stimulus that's out there. They're stimulating the airlines, right? Well, it's almost impossible for black businesses to do business with United or Delta or American Airlines. And they gave money to the Kennedy Center. We've tried to call on the Kennedy Center to see whether they want to do business with black folks, and they basically had no interest. It was like no interest. So they're taking our taxpayer dollars to bail out these big, giant institutions who don't want to work with us. We can't grow our businesses unless we have customers. You know that. And it's just like people have lost sight of that. We have good role models who've done it well. McDonald's probably being the one that's been the best throughout, for the longest period of time of supporting black franchisees, supporting black suppliers, having black executives, even an African-American CEO there. We got to have more and more of those types of institutions that realize by partnering with the black community, it makes all of us stronger. As we create wealth in our community, it makes our country stronger. It's just as Reverend Jackson always says, when baseball started including Jackie Robinson and then Hank Aaron and Ernie Banks, baseball became a better sport. Our business community would be stronger broadly if African Americans are allowed to fully participate in all aspects of our capitalist democracy.
Yes, indeed. John Rodgers Jr., Co-Chief Executive, Arrow Investments. John, we appreciate it. Thanks a lot.
Well, thanks so much, Roland.
All right, folks.
Appreciate it.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders.
John Hope Bryant, he's the founder of Operation Hope.
Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin,
Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association,
Malcolm Nance, family medicine physician, Dr. Jen Cardle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York,
William Spriggs,
AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriot with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon McDougall, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King.
We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else. in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.